Have you ever known someone who seemed perfectly fine one day only to suffer a heart attack without warning the next? Stories like these are heartbreaking and they often leave families asking the same painful question: were there any signs we missed? The truth is that while some heart attacks happen suddenly, many people experience symptoms beforehand. These warning signs can appear days or even weeks in advance, although they vary greatly from person to person. They are not guaranteed, and having one or more of them does not necessarily mean a heart attack is about to happen. However, recognizing them early and seeking prompt medical attention can make a life saving difference. After the age of 60, paying attention to changes in your body becomes more important than ever. As we grow older, the risk of heart disease naturally increases. Conditions such as high blood pressure, diabetes, high cholesterol, smoking, obesity, chronic stress, and a family history of heart disease can all increase that risk. The encouraging news is that many heart problems can be managed more effectively when they are detected early. That's why understanding your body's warning signals is one of the most valuable steps you can take to protect your health. Today, we're going to discuss 9 warning signs that may appear before a heart attack. These are not meant to frighten you or encourage self diagnosis. Instead, they are intended to help you recognize changes that deserve medical attention. Never ignore symptoms that are new, persistent, or severe, especially if they involve your chest, breathing, or sudden weakness. If you think you may be experiencing a heart attack, seek emergency medical care immediately rather than waiting to see if the symptoms disappear. Stay with me until the end because the final warning sign is one that many older adults mistake for simple aging or fatigue, when in reality it can sometimes signal that the heart is working harder than it should. Before we begin, let's take a moment to understand why these warning signs occur. Your heart is a powerful muscle that pumps oxygen rich blood throughout your body every second of your life. To perform this job, the heart itself needs a constant supply of oxygen through the coronary arteries. When these arteries become narrowed by fatty deposits, blood flow may gradually decrease. If one of these arteries suddenly becomes blocked, part of the heart muscle can be damaged, resulting in a heart attack. In many cases, the body begins sending subtle signals before a complete blockage occurs. These signals may reflect reduced blood flow, increased strain on the heart, or other underlying cardiovascular problems. While not everyone experiences warning signs, knowing what to look for may help you seek medical care sooner. The first warning sign is chest discomfort. Many people imagine a heart attack as sudden, crushing pain in the center of the chest. While that can happen, the reality is often more subtle. Some people describe it as pressure, tightness, squeezing, heaviness, or a feeling that something heavy is sitting on the chest. Others experience mild discomfort that comes and goes over several days or weeks, especially during physical activity or emotional stress. This type of discomfort may improve with rest because the heart temporarily needs less oxygen. However, recurring chest discomfort should never be ignored, especially if it is new or different from anything you've experienced before. Although chest pain has many possible causes, only a healthcare professional can determine whether it is related to your heart. The second warning sign is unusual shortness of breath. Have you ever noticed that climbing a flight of stairs suddenly feels much harder than it did a few months ago? Perhaps you find yourself becoming breathless while carrying groceries, walking across a parking lot, or performing simple household tasks that never caused problems before. While aging naturally affects stamina, a noticeable change in your breathing deserves attention. When the heart cannot pump blood as efficiently as it should, the lungs and muscles may receive less oxygen rich blood during activity. As a result, everyday tasks begin feeling more exhausting. Some people notice shortness of breath only during exercise, while others experience it even while resting or lying flat in bed. If breathlessness appears suddenly, becomes severe, or occurs together with chest discomfort, dizziness, nausea, or sweating, it requires immediate medical evaluation. Even gradual changes should be discussed with your healthcare provider because they may reflect heart disease, lung conditions, or other medical problems that benefit from early diagnosis. The third warning sign is discomfort that spreads beyond the chest. One reason heart problems are sometimes overlooked is that the pain isn't always located where people expect. Instead of remaining in the center of the chest, discomfort may spread to the shoulders, arms, neck, jaw, upper back, or even the upper abdomen. Some people experience pain primarily in the left arm, while others notice it in both arms or only in the jaw. Women, in particular, may experience less typical symptoms than men. Instead of severe chest pain, they may notice pressure, unusual fatigue, nausea, shortness of breath, or discomfort in the back or jaw. Because these symptoms can seem unrelated to the heart, they are sometimes mistaken for indigestion, muscle strain, or simple tiredness. The important message is this: your body doesn't always follow a textbook description of a heart attack. If you develop unexplained discomfort that spreads to your arm, jaw, neck, or back, especially when combined with other symptoms such as shortness of breath, sweating, dizziness, or nausea, don't ignore it. Seeking medical attention promptly could make all the difference. Many older adults assume these early changes are simply part of getting older. They tell themselves they'll rest for a few days or wait until their next appointment. But when it comes to your heart, waiting can sometimes allow a serious problem to become much more dangerous. Listening to your body doesn't mean expecting the worst. It means recognizing that small changes today may deserve attention before they become emergencies tomorrow. The fourth warning sign is unusual fatigue that doesn't seem to have an obvious explanation. Everyone feels tired from time to time, especially after a busy day or a poor night's sleep. But many people who later experience heart problems describe a different kind of exhaustion. It's a deep, persistent fatigue that seems completely out of proportion to their daily activities. Some people say they suddenly need to rest after simple tasks like making the bed, folding laundry, or walking to the mailbox. Others notice that climbing stairs leaves them completely drained when it never used to. This kind of fatigue can develop gradually over several weeks. Instead of feeling refreshed after a night's sleep, you may wake up already feeling exhausted. Although fatigue has many possible causes, including anemia, thyroid disorders, poor sleep, infections, and certain medications, it should never be dismissed if it is new, persistent, or accompanied by other symptoms such as chest discomfort or shortness of breath. The fifth warning sign is dizziness or feeling lightheaded. Your brain depends on a steady supply of oxygen rich blood to function properly. If your heart is struggling to pump effectively or your blood pressure suddenly changes, you may feel faint, dizzy, or unusually unsteady. Some people describe it as feeling like they might pass out, while others notice brief episodes of blurred vision or loss of balance. Occasional dizziness may result from dehydration, standing up too quickly, or certain medications. However, repeated dizziness, especially when combined with chest discomfort, palpitations, shortness of breath, or fainting, should always be evaluated by a healthcare professional. If someone loses consciousness or develops severe chest pain with dizziness, emergency medical care is needed immediately. The sixth warning sign is breaking out into a cold sweat without a clear reason. Imagine sitting quietly in a comfortable room when you suddenly become covered in cool, clammy sweat. You're not exercising, the room isn't hot, and you don't have a fever. This unexpected sweating can sometimes occur when the heart is under significant stress. Many people mistake this symptom for anxiety or simply feeling overheated. While stress and panic attacks can certainly cause sweating, unexplained cold sweats that occur together with chest pressure, nausea, dizziness, or shortness of breath should never be ignored. The combination of these symptoms may require urgent medical attention. The seventh warning sign is nausea, indigestion, or unexplained stomach discomfort. This surprises many people because they don't immediately associate digestive symptoms with the heart. Some individuals, especially older adults and women, experience heart related symptoms that feel more like heartburn or an upset stomach than chest pain. They may notice pressure in the upper abdomen, persistent nausea, or a sensation similar to severe indigestion. Of course, stomach discomfort is extremely common and usually has harmless causes such as overeating, acid reflux, or a stomach virus. However, when digestive symptoms are unusual, persistent, or occur together with chest discomfort, sweating, pain spreading to the arm or jaw, or difficulty breathing, they should not simply be dismissed as indigestion. The safest approach is to seek medical evaluation rather than trying to diagnose the cause yourself. Another symptom that deserves attention is a rapid, pounding, or irregular heartbeat. Most people occasionally notice their heart beating faster after climbing stairs, drinking coffee, or feeling anxious. That's completely normal. But if your heart suddenly begins racing, skipping beats, fluttering, or pounding while you're resting, it's worth paying attention. These sensations, known as palpitations, may have many causes. Stress, caffeine, dehydration, certain medications, thyroid disorders, and abnormal heart rhythms can all contribute. While many palpitations are harmless, others may indicate an underlying heart condition that requires evaluation. If an irregular heartbeat occurs together with chest pain, dizziness, fainting, or severe shortness of breath, immediate medical care is essential. One important lesson from everything we've discussed so far is that heart attack warning signs rarely appear in exactly the same way for every person. Some individuals experience only one or two subtle symptoms. Others develop several warning signs at once. Some symptoms come and go over days or weeks, while others appear suddenly. That's why listening to changes in your own body is so important. Many people delay seeking help because they worry about overreacting or embarrassing themselves if the symptoms turn out to be something less serious. But healthcare professionals would much rather evaluate symptoms that turn out not to be a heart attack than have someone stay home while a serious heart problem continues untreated. When it comes to the heart, acting early can preserve heart muscle and, in many cases, save lives. There are also several practical steps you can take to reduce your long term risk of heart disease. Staying physically active within your abilities, eating a balanced diet rich in vegetables, fruits, whole grains, legumes, and healthy fats, avoiding tobacco, maintaining a healthy weight, managing stress, getting enough sleep, and controlling conditions such as high blood pressure, diabetes, and high cholesterol all contribute to better cardiovascular health. Regular checkups are equally important. Simple measurements such as blood pressure, cholesterol levels, blood sugar, and routine discussions with your healthcare provider can identify risk factors before they lead to more serious problems. Prevention is always more effective than waiting until symptoms become severe. Most importantly, remember that recognizing possible warning signs isn't about living in fear. It's about becoming more aware of your health and responding wisely when your body tells you something has changed. Small changes may not always signal a serious problem, but they deserve attention rather than being ignored or explained away as just getting older. The eighth warning sign is swelling in your feet, ankles, or lower legs that seems unusual or gradually becomes worse. Many older adults notice some swelling after standing for long periods or during hot weather, and in many cases, this is harmless. However, persistent or increasing swelling can sometimes be a sign that your heart is not pumping blood as efficiently as it should. When this happens, fluid may begin collecting in the lower parts of the body because gravity naturally pulls it downward. You might notice that your shoes suddenly feel tighter, your socks leave deep marks around your ankles, or your feet appear puffier than usual by the end of the day. Some people find that the swelling improves slightly overnight but returns each afternoon. Others notice that it gradually becomes more frequent over several weeks. Of course, swelling has many possible causes. Problems involving the veins, kidneys, liver, certain medications, or even prolonged sitting can also contribute. That's why it's important not to jump to conclusions. However, if swelling develops together with shortness of breath, chest discomfort, unusual fatigue, or rapid weight gain over a few days, it deserves prompt medical evaluation because it may indicate fluid retention related to the heart. The ninth and final warning sign is a noticeable decline in your ability to perform everyday activities. This may sound vague, but many people who later develop serious heart problems describe the same experience. Tasks that once felt easy suddenly become much more difficult. Perhaps walking around the supermarket leaves you exhausted. Maybe carrying groceries from the car feels surprisingly difficult. You may find yourself stopping to catch your breath after climbing only a few steps, or needing frequent breaks while doing simple housework. Because these changes often develop gradually, many people simply blame aging. They tell themselves, I'm just getting older, or I'm probably out of shape. While aging naturally changes our physical abilities, a sudden or noticeable decline should never automatically be accepted as normal. Your body may be telling you that something deserves closer attention. Another symptom that sometimes accompanies heart disease is difficulty sleeping because of breathing problems. Some individuals notice that they need extra pillows to sleep comfortably or wake up during the night feeling short of breath. Others experience episodes where they suddenly sit upright because they feel they cannot catch their breath. These symptoms can have several causes, but they should always be discussed with a healthcare professional because they may indicate that the heart or lungs require further evaluation. Now that we've discussed all 9 warning signs, one question remains. What can you do to lower your risk of heart disease? The good news is that many of the most effective strategies are well within your control. Regular physical activity is one of the best investments you can make in your heart. Even a brisk walk for 30 minutes on most days of the week can help improve circulation, support healthy blood pressure, strengthen the heart muscle, and improve overall fitness. If you have medical conditions or haven't exercised in a long time, speak with your healthcare provider before starting a new exercise program. Nutrition also plays a major role. A diet rich in vegetables, fruits, whole grains, beans, nuts, lean proteins, and healthy fats can support heart health over the long term. Limiting highly processed foods, sugary drinks, excessive sodium, and foods high in saturated fat may help reduce several important cardiovascular risk factors. Remember, healthy eating is about consistent habits rather than perfection. Managing chronic conditions is equally important. High blood pressure, diabetes, and high cholesterol often develop silently without obvious symptoms, yet each significantly increases the risk of heart attack and stroke. Taking prescribed medications consistently, monitoring your health, and attending regular medical appointments allow these conditions to be managed before they cause serious damage. If you smoke, quitting remains one of the most powerful decisions you can make for your heart. Within months of stopping, your circulation begins improving, and over time, your risk of heart disease gradually decreases. It's never too late to benefit from quitting, regardless of your age. Quality sleep also deserves attention. Adults who consistently sleep too little or experience untreated sleep disorders may have a higher risk of developing cardiovascular problems. Creating a regular bedtime routine, limiting caffeine late in the day, and discussing persistent sleep problems with your healthcare provider are worthwhile steps. Stress management is another piece of the puzzle. While stress alone doesn't directly cause most heart attacks, long term stress may contribute to unhealthy habits, elevated blood pressure, and poor sleep. Activities such as walking, spending time with loved ones, gardening, reading, or practicing relaxation techniques may help reduce stress and improve overall well being. Perhaps the most important message from today's discussion is this: never ignore persistent or unusual symptoms simply because you think they are part of getting older. Your body has an incredible ability to signal when something isn't right. Paying attention to those signals doesn't mean expecting the worst. It means giving yourself the best opportunity to seek medical advice early, receive appropriate treatment, and potentially prevent a much more serious event. Finally, remember that if you or someone around you develops sudden chest pressure, pain spreading to the arm, jaw, neck, or back, severe shortness of breath, fainting, or other symptoms suggesting a heart attack, do not try to drive yourself or wait to see if the symptoms improve. Call your local emergency medical services immediately. Rapid treatment can save heart muscle, reduce complications, and save lives. Acting quickly is always safer than waiting too long. As we come to the end of today's video, remember one important message. Your body often gives you clues when something isn't right, but those clues are not always obvious. Chest discomfort, unusual fatigue, shortness of breath, dizziness, swelling, or pain that spreads to the arm or jaw should never be ignored, especially if these symptoms are new, severe, or keep returning. While these warning signs do not always mean a heart attack is about to happen, they are your body's way of telling you that it's time to seek medical advice rather than waiting and hoping the problem will disappear. The good news is that many heart attacks and other serious heart conditions can be prevented or managed more effectively when risk factors are identified early. Staying physically active, eating a balanced diet rich in fruits, vegetables, whole grains, and healthy fats, avoiding tobacco, managing blood pressure, cholesterol, and blood sugar, maintaining a healthy weight, and attending regular medical checkups all play an important role in protecting your heart as you grow older. If you found this video helpful, take a moment today to share it with a friend or family member over the age of 60. One simple piece of information could encourage someone to recognize an important warning sign and seek medical attention sooner. We'd also love to hear from you in the comments. Which of these warning signs surprised you the most? Don't forget to like this video, subscribe to the channel, and turn on notifications so you never miss our latest videos on healthy aging, heart health, and senior wellness. Thank you for watching, take care of yourself, and remember, when it comes to your heart, it's always better to act early than to wait too long. Stay healthy, stay informed, and I'll see you in the next video.